Assalamualaikum and hello everyone. Today we are going to present our CSR project on performing HIRARC assessment at Health Center Pusat Kesihatan UTM. But before we go into details, we are going to tell you about what HIRARC is. So, HIRARC is an acronym which every two letters represent a step. The first two letters HI stands for Hazard Identification, RA Risk Assessment, and finally RC Risk Control. So, what is HIRARC? Hazard identification is defined as anything such as situation or behavior that has the potential to cause harm. Hazard could give an adverse effects like bodily injury, disease, and even equipment losses. One of the methods to identify the hazard is by analyze for an unsafe act at each work area. Moving on to the risk assessment. Risk assessment is a measurement to analyze and evaluate the hazard. The measurement is made by identification on how severe and when likely of the hazard. Risk can be calculated using the following formula. Risk is equals to likelihood times severity. As the value of risk assessment has been calculated, thus risk level can be determined. Next, risk control is the elimination or inactivation of hazard. There are 5 risk control methods from the most effective to the least. Firstly, elimination. This can be done by removing the risk entirely from the workplace. Secondly is substitution, in which the swapping an item or work process for a safer one. Thirdly is an engineering controls. This is where a modifications to the environment or equipment that poses the risk. Next is an administrative controls, by redesign work methods to reduce the conditions of risk such as rotating employees through several different work tasks. Lastly, personal protective equipment (PPE). It is the last resort when hazard cannot be removed by any other means. For instance, safety gear worn by the worker. The risk control methods can be summarized in the hierarchy control pyramid chain.
For our group, the workplace that we choose to conduct our HIRARC assessment is Pusat Kesihatan University at University Technology Malaysia. The reason why we choose this place is because Health Center is one of the many workplaces that is constantly surrounded by hazard. Thus, this video is made targeted to health professionals. Health professionals comprises a wide variety of professions and occupations such as doctors, nurses, physicians, and pharmacists. Health professionals diagnose, treat, and prevent human illness, which at their line of work, they are constantly exposing themselves to hazards. Therefore, in our assessment, we managed to identify some hazard that comes along with this job. By HIRARC, the hazard that has been identified is as follows. Firstly, there is the potential for physical hazard caused by radiation. Radiation is an emission of high-energy particles that penetrate tissue, which causing ionization. Regularly being exposed can put you in literal danger. Source of radiation can come from X-ray, CT scan, and also nuclear imaging. For its risk assessment, we can look into the table matrix of severity and likelihood that we mentioned earlier. The likelihood of this event can be categorized as 4, as well as the severity level. This is because the amount of radiation absorbed by the body, which is the absorbed dose, determines how sick you'll be. Ionizing radiation can damage DNA, which the result of DNA mutations may contribute to cancer years down the road. This totals up the risk level to 16, which put it in major concern. So how to control the risk? Looking back at the hierarchy control pyramid chain, for this situation, the most suitable risk control plan is by engineering controls, which will isolate the workers from the hazard itself. Radiation can be prevented by building a designated room with lead-lined plywood material for shielded wall systems. By executing the risk control plan, we can lower the likelihood to 2 and also severity to 2, and that gives us 4, which means that the risk identified is not acceptable. There are many other HIRARC examples that could be found in a health center, such as biological hazard that comes from viruses and ergonomic hazards coming from repetition of awkward posture. In the end, assessing possible hazard in any workplace is important in order for us to know how to control the risk. In conclusion, health professionals regularly expose themselves to danger because of their job scope to provide service for ill people. Therefore, it is important to have systematic safety measures to ensure the health and safety of the workers in this profession. And that marks the end of our video. So that's all from me, Azrin Shafiqah, and my partner Nur Adila Asri about HIRARC at healthcare. We would like to also thank you to our Dr. Mimi Harani Hasim for assisting us in this class project. So that's all from us. Thank you. Bye.